There's no health without mental health.
Biggest challenge around mental health is the stigma.
In 2017, I got depressed for the third time.
December 31st, 2021 was a tough one, and in fact, even dropped a suicidal note for a colleague in the office.
I was clinically diagnosed with depression in 2014.
Mental illness is not a death sentence.
Sometimes we talk about mental health as if we're talking about mental illness.
Mental health, it involves our emotions.
We have a large population to attend to. Everybody wants to come to Lagos.
Most people would still associate mental health issues with spiritual problems.
Culturally, we need to begin to understand more that a person who has a mental health challenge is not a mad person.
Mental health disorder, we're asking if it is a neglected disease.
Most of the people who need psychiatric care cannot afford it.
It's one of those diseases it's in your mind. You can't see it, you can't palpate it, you can't measure it.
Lagos, Nigeria's center of excellence and West Africa's commercial capital, is home to more than 14 million people. With no fewer than 86 visitors coming into the city on the stroke of every hour, it is enviably the only Nigerian city with a population reflecting every tribe in the country. It is also the land of aquatic splendor, bustling with abundant marine life and natural endowments. As Nigeria's economic capital, it has remained a model for other states in providing quality leadership and long-term planning in public administration. Little wonder that this city of industrial powerhouse doubles as a destination of choice for tourists visiting Africa.
I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday.
Like all other major cities around the world, Lagos was not spared the horror of the COVID-19 pandemic, with its attendant impact in accelerating mental health disorders among populations.
COVID showed us that it was a bit deeper than we thought. And so we started examining it a bit closer. And then we started realizing there was a need to address mental health in COVID. And then we also had a lot of our civil servants that had, because of the pressure of work, the pressure of living in Nigeria, the pressure of money and everything, that had severe mental health issues that actually probably only manifested in violence.
People are faced with a lot of challenges every day in their personal lives, in their relationships, at their work. Lagos traffic. And so by the time you look at all of these things, these are all of the things that pose challenges to individuals, either in their own personal lives or in their lives as the community.
We have to realize that Lagos state population is 20 million estimated, and it's a very densely populated area. So the challenges that you are likely to get in a densely populated area are psychological stress affecting many people, anxiety, depression, post-traumatic stress disorders, affecting people who are densely populated. So those are the common mental health problems that we have.
According to clinical findings made by the Lagos State Ministry of Health's Mental Health in Development Project, an average of 20.4% of the population reported significant depression symptoms, while an average 1.5% frequently had thoughts of suicide or deliberate self-harm in the wake of the virus.
between 4 to 5% of Lagosians actually have anxiety disorders, and between 3 to 4% of Lagosians are actually depressed. So the challenge is huge by the time you realize that we are talking about 20 million people.
It's getting towards an epidemic. But because of our environment, people don't tend to not take it very seriously. So it's a big issue.
The study also reveals that 22.4% of the population showed symptoms of significant anxiety, with an average of 10% of the population combining anxiety with depression.
The number of studies have been conducted in Lagos State, and it has also shown that there's a significant amount of, the population are dealing with drug addiction problems, dealing with mood and anxiety problems, dealing with, so many emotional problems.
As the pandemic slowly settled, persons suffering from mood disorders were found to have risen from 3.3% before the outbreak to 9.8% in the aftermath. Anxiety grew from 5.7% to 15.8%. Substance abuse from 3.7% to 13.3%, and psychotic disorders from 1% to 4.4%.
My first experience of depression was in 2012.
I experienced depression, anxiety, and stress.
After I lost my husband, I just realized I had no will to live.
At that point, it was more, I wanted it to be over, like the pain I was feeling.
So I couldn't sleep, I wasn't eating, I lost interest in everything and anything.
You get quite anxious, you worry, you get, obviously those feelings are real to you, but some of your fears and your worries are irrational.
I wanted it to be over. That was the thoughts that was just going through my mind. Like I was over it and I was done dealing with it, and I didn't think anyone would have cared.
It was pretty difficult to convince some of my friends that, guys, this thing is not a lie. Like, it happened to me. Like, I'm in that state right now.
Whenever I feel depressed, I feel empty.
Stories like this drove health officials to action, already armed with a solution that was older than the problem.
In 2011, the conversations around what should obtain became very critical.
First mental health policy to be actually implemented positively by any government in Nigeria was the one that was enunciated in Lagos State in 2011, 2012. Okay? And that came again when I was there with Dr. Idris.
We drew up the policy, mental health policy. It's supposed to guide us on how to address the issue. And one of those things that we needed to do again, publicity is one, public enlightenment is one. Mental health, because of our culture and the stigma associated with it, people would never come out.
The purpose of it was to put mental health in a formal way in the public space and get people to discuss it.
So in that year, we put together a stakeholder committee, including academicians, people who are mental health professionals, to begin to look at developing a policy that can drive the agenda for mental health in Lagos. And one of the key lines for that policy was the establishment of a mental health desk, so that can serve as the focal point for programs, services, engagements with community members, engagements with non-governmental organizations, and other governmental organizations, civil society organizations that had a role to play in the mental health space.
Hello, good morning. Yes, na Lagos Lifeline with this. My name is Ijiro, who I follow talk this morning.
The Lagos Mental Health in Development, an initiative of the Lagos State Ministry of Health, was created to deliver mental health care and services in a bid to reduce the burden of mental health problems in the state. Ms. Adefunke Shonubi, who is the team lead Lagos Lifeline, narrates what it takes to provide psychosocial support with the mental health helpline to Lagos residents.
In fact, setting up the mental health desk in itself and having a mental health policy and a mental health law has made Lagos State a forerunner state in, in its mental health, provision of mental health services, policy and promotion in Nigeria. Also, we have established the Lagos State Mental Health School Maps program, which is essentially providing mental health awareness and prevention strategies to schools. And another project we have is the maternal mental health program, which focuses on postpartum depression with women. So we go to antenatal clinics to let them know what it is and what to look out for.
Lagos State has done a good job of advocacy with the Lagos Helpline, which is giving people a number that you can call in at any time, a call center, and talk about mental health issues.
Good morning.
The Lagos Lifeline, which is the state's first telebehavioral health helpline, started in 2020, although it was officially launched in April 2021. And we have seen over 10,000 cases. Most of the cases are usually depression, substance abuse, and suicide, with substance abuse and suicidal attempts being more of the cases that we see.
We understand, the fear of speaking up because you're afraid of what other people would say. It's a real fear, and nobody's going to say that it doesn't exist. But for us, what is important is being able to ensure that we maintain confidentiality.
If you look around, there aren't that many helplines that people can call. And the beauty of a helpline is not like, oh, I'm feeling bad. Okay, tomorrow morning I'll go and see a doctor. It's right here and now. Pick up the phone, talk to someone who can, just calm you down. So it's good. And the beauty again of it, it's a lot of our counselors there are really young people.
But beyond these are details of a project that are more than a response plan.
We're moving towards developing probably the most comprehensive healthcare facility in Africa. Certainly in Nigeria, we're building a 500-bed psychiatric hospital. I don't know of any hospital that looks after mental health that's bigger than that, and that's just the phase 1. Phase 2 is going to be expanded to take care of rehabilitation, so we have about another 1,000-bed rehabilitation facility next to the 500-bed psychiatric hospital in Ketu Ejiri, between Ikorodu and Ekpe.
My biggest fear is a political leader who would not empathize or understand the need to fund mental health issues. And my biggest joy is that the biggest edifice being built right now in Lagos State is a psychiatric hospital.
As the First Lady of the state, Dr. Ibijoke Sanwo-Olu, said at the launch of the Lagos Employee Wellness Center, LASWELL, full health cannot be discussed in isolation of mental health. So also, can mental health delivery not be effective without attention to detail and careful planning? This is what has perhaps made the Lagos State Ministry of Health's Mental Health and Development Mind Agenda a peculiar model for mental health administration in its own right.
My name is Tolisha De Francis. I experience depression, anxiety, and stress.
My name is Falakia Falano. I'm a lawyer, and I was clinically diagnosed with depression in 2014.
These mental illnesses don't define me, and it just tells you that we are all human.
What separates us in the now is time, chance, and circumstances.
Everybody has the potential to have a mental health concern.
People who are mentally challenged, they didn't plan to be mentally challenged.
There's a very thin line between a mental health breakdown and a normal person.
Mental health illness can happen to anybody.
You need someone you can always talk to. Call the helpline.
Ask for help, and your colleague, your daughter, your friend, your husband will do better.
People who look down on people with mental health challenges, all I've got to say to them is, well, I just pray yours doesn't come.
The Lagos Mental Health in Development is waiting for your call and your messages. We are only a call and a message away.